So my postdoc, Kacie Deters, has this really exciting data that she presented at this conference just yesterday. So it's a very interesting story, such that in African Americans, ApoE4 is more prevalent, so more African Americans actually have this risk allele. However, the risk of ApoE4 on Alzheimer's dementia, of actually being clinically diagnosed with Alzheimer's disease, is diminished. So there's this mystery of why is ApoE4 acting differently in the context in African Americans compared to when we estimate this risk in our traditional European samples, which unfortunately most of the studies that we have, most of these biomarker studies and large studies, all have European individuals. It's just this horrible selection bias that we have. So my postdoc was interested in understanding, why might this be the case? Why do we see this diminished effect of ApoE? And it turns out, so if you look at African Americans, and there's ways of computing ancestry. So you can think of ancestry as a decomposition of these 5 superpopulations. So European is one superpopulation, African is another superpopulation, then there's 2 Asian populations in that, and also the Americans. And then each individual will have 5 of these values that sum to 1. So you can kind of think of individuals as having this combination. So African Americans, not surprisingly, are a mix between African ancestry and European ancestry. And if you compute these measures, you see this continuum that ranges anywhere from 10% African ancestry all the way to about 90%. And it's really this continuous variable. So what Kacie showed is that this variable is a large predictor of the effect of ApoE on decline. So of individuals that self-identify as Black, those that have high African ancestry, so those that are about 80% or higher in their ancestry measure, do not have decline related to ApoE, whereas those with lower amounts of African ancestry do have ApoE4 related decline. So it's intriguing because it's consistent with this idea of a diminished effect of ApoE in African Americans, but it's completely dependent on this continuous level of ancestry. And this is a relatively easy number to compute as well. So it would be a nice thing to consider adding into estimates of individual risk. And it also highlights that even though we have these established genetic predictors of Alzheimer's disease, that the consequences vary across different genetic backgrounds, which is a really important concept for the idea of individual level risk of AD.